Yeah, so the question was, if you have your prostate removed, should you just urinate normally again? It's a great question because some men actually have a lot of obstructive urinary symptoms, have a real hard time urinating, and they actually may be better suited to have a radical prostatectomy just because they are already having a lot of difficulty voiding. Because if they undergo radiation therapy, they may have a whole course full of trouble where they have trouble urinating afterwards and they can't empty their bladder. In many of the decades of the past, a number of men would have transurethral resections of the prostate first and then have radiation. I was never really a fan of that because I always found that those guys ended up having more urinary control issues. So I'm of the belief that if you're waffling between two types of therapy and you have significant difficulty voiding, you probably should lean more towards having surgical removal of the entire prostate. Because when the prostate's removed, the bladder neck actually now becomes your control mechanism in addition to your voluntary sphincter. And so with robotic surgery, your bladder neck can be recreated to be snugged down and sutured directly in anastomose to the urethra to give you good urinary control postoperatively.
Yeah, I agree with that completely. If we radiate someone with a very large prostate, someone who's already struggling with urinary symptoms, I really do not want to treat that patient. I'll take someone who's unhappy and make them downright miserable. Radiation can be an excellent treatment for men who have good urinary function, and they can come out exactly the same on the other end. But if you've got significant underlying symptoms, there's a good chance we can do a lot of damage.